explain to you two types of movement in our shoulder. And this shoulder blade goes on top of the rib cage. The shoulder blade has motion where it can elevate and it can depress, it can externally rotate, and it can be internally rotated. Another structure that we want to talk about is glenohumeral joint, which is the joint of arm into the shoulder. So this is where muscles are rotator cuff, allows motions of abduction and also depression, external rotation and internal rotation. Shoulder. Their function is when they contract, they elevate the shoulder blade like this. There's a muscle called rhomboid which connects to the medial border of the shoulder blade. When it contracts, it actually creates external rotation. So serratus anterior almost looks like a rib cage. It comes around from the front and it connects to the back of the arm and comes around. Called pectoral. When these things contract, it creates the shoulder blade to go forward as well. Latissimus dorsi and lower trapezius, when they contract, it allows depression of the shoulder blade. So the shoulder joint motion is actually dictated by these motion. If these things move well, it puts less stress on the shoulder joint. Here to here, it's called supraspinatus, infraspinatus, teres minor, and subscapularis. There's a muscle that connects to here and go underneath the shoulder blade. Supraspinatus muscle allows elevation of the teres minor and the infraspinatus. When they contract, it creates external rotation of the arm. And subscapularis, when it contracts, it creates internal rotation. This is actually called clavicle, and this is the acromion process. That's part of the shoulder blade. So when a person falls down and puts pressure right into this joint, there's a ligament in between the collarbone and the clavicle, and these ligaments are supposed to be very tight and allows good structural balance. But it can push the ligament where it starts to open up. It's grade 1, 2, and 3. Grade 1, we can definitely manage and treat it conservatively. Grade 2, it gets a little bit more severe. 3, that's when all the ligaments around this area starts to tear up. Need actual surgical intervention as well. Now, along with the AC separation, a person may break this collarbone. So when that collarbone is fractured, it also loses the integrity of the joint, which leads to some different type of problems. So Joe creates a lot of forces on the bicep, and the tendon that connects from the bicep starts to give out. So it's like an elastic band that just kind of snaps. Actually reduce the strength of this bicep, then you're putting stresses on other parts of your shoulder, such as the rotator cuff. And the whole role of bursa is it's actually a cushioning. So it allows when the arm starts to move, that sac allows the joints to move smoothly. Is if you had injuries to the shoulder, or if you have bicep tear, it can cause inflammation, it can cause swelling, which causes the bursa to thicken up. And when it thickens, all the tissue inside the joint gets compressed, therefore leads to impingement syndrome. This is frozen shoulder syndrome. So our body has a lot of collagens and connective tissue. They're like a saran wrap that covers the muscle. If you have injury, these connective tissue, what it tends to do, instead of forming in a nice smooth layer, they start to kind of lie all over the place, like a cobweb, weakness and restriction. So when a person starts to kind of move, all of a sudden they can't raise their arm, they can't scratch behind the back, behind the neck. So that's because of adhesive capsulitis or frozen shoulder syndrome. Related to factors like diabetes, thyroid problem, low circulation, also immobilization or tear and injury. So when you have a nerve flow coming from here, traveling to the spinatus muscle is also connected by C5 and 6, and teres minor and subscapularis all connected to C5 and C6. So if a person has a neck injury, they have a whiplash, and the nerve is pinching and causing irritation, it could also cause weakness in these muscles. It causes imbalance, and that imbalance can cause inflammation and injury as well. Okay? Rotator cuff tear could be a result of repetitive motion like playing tennis. It could be a result of a fall. It could be a result of simple things as trying to start a lawnmower. Force is too stronger than the body. The rotator cuff is slightly torn, and then there's a full thickness tear where the rotator cuff is completely torn. You know, to reduce pain, reduce swelling, and restore function could be simple using as ice and ultrasound first. In our clinic, we use laser to speed up healing, acupuncture, adjustment, taping. Having severe pain because they have a full thickness tear, they may need to get some cortisone injection to reduce inflammation, and also eventually some surgery to reattach the tendon as well. Determine what sort of injury that they have is, first of all, doing a good history, doing an orthopedic examination, doing some range of motion. X-ray. X-ray does not show tendons and ligaments, but it will show things like joint degeneration and calcification and arthritis if the person has shoulder problems for a long period of time. Ultrasound, that actually shows some good imaging of soft tissue tear, and the MRI allows much more accurate imaging of the tear. It can be rehabilitated in a conservative way, or it needs to be intervened in a more of a surgical procedure. AC separation could lead to bicep tendon tear. The bicep tendon tear could lead to stress to the rotator cuff, which causes rotator cuff tear, and that could lead to frozen shoulder syndrome. So all these things could actually contribute and they work together.
You choose the large intestine valve, which is located, you can see when you bend your arm, so you can see the end of the crease. So this is the point you can use your thumb to give gentle form pressure to the top of the shoulder. So on the midway of connection line, this is called Jian Quan. 1 inch up is on here. This is called smaller intestine 9. So you can massage it, so delta. Stomach 38, which this point is very good result to achieve the shoulder problem. So you can massage by yourself. Use your thumb, gentle form pressure.
Arm, he actually raises it at around 45 degrees angle. So when he goes up 45-degree angle, then he comes down. It allows stimulation of rotator cuff like supraspinatus, infra and teres minor to actually help control the motion and then control motion down. So basically his shoulder blade comes closer. Then as he does the exercise, he's maintaining that structure. So this muscle is actually supporting the shoulder as he comes out. So same thing, if the person is a bit smaller, use a smaller ball. But if the person's bigger, use a little bit thicker ball. On one knee like this. Okay? He's going to hold the kettlebell, and what he's going to do is kind of gently kind of move around as if the forearm is touching his forehead, and wrap around behind the neck, and then come around, forearm touching the left forearm, and then the side, come around, and back. Okay, around, behind, and come forward, and then do the reverse. Come around, circle around, and back. And you can use it back. As he brings up, he's not going to shrug here, but he's bringing the shoulder blade out, contracting the rhomboid. Then he's relaxing again, allowing the serratus anterior and pectoris to kind of push it up. Bring it up, and relax. So very small movement, but a very fine movement to help stimulate the muscle that supports the shoulder blade, and also to help retract again, turn again. Very good exercise to help stabilize the shoulder as well. Okay, thank you. Okay, pause here, hook it right here, out, and come back. So he's using 10 pound out, same motion, bring it out. Okay, again, working the back side of this muscle, using rhomboid as he comes up, using teres minor as he goes up, goes down. Okay, using latissimus dorsi as he turns in, as he pushes out, using serratus again. 1, 2, 3, 4, 5, and 6. That actually improve lymphatic system, right?
Yes, yes. You can see, as you just say. So in the clinical, we can also do on the whole shoulder.
Yeah.
And the broader
raised up, and the lymphatic system and the blood flow is increasing, there's better chance for the nerve and muscles to function better, right?
Good, yes.
If the person is aware of their problem, then they have a better chance of healing. And so, please, give us a call, a full 10 to 15 minutes, talking to you about your challenges, and give you some advices and maybe some solutions to